It bothers me a lot when I have to tell somebody they have lupus that affects their kidneys or affects their lungs, or I know is going to be a major issue and that I'll have to use a lot of medications to suppress their immune system. That's a hard thing to do.
It's incredibly frustrating to be diagnosed with something and then have absolutely no clue how to tell someone what it is that you have.
Yet we hear very little about it.
There's a lot of disinformation out there. A lot of people who've heard of lupus but really don't know what lupus means.
In the African American community, we have a lot of people that do have lupus, and they were like me. They didn't have the money to support this all the time. They didn't have the knowledge. They didn't know what doctors to go to. You know, they were very ashamed.
Just hand you a prescription and say this may help, it may not help. It may take 6 months to a year to help, or it may never work.
Any type of funding is going to have to come from raising people's awareness and making them realize that this is a problem and that there are a lot of people out there who are affected by it who need help.
People are dying before they can get the treatment. So it's critically important that we really work hard to get these women into early treatment programs.
Lupus is a chronic autoimmune disease in which the body's own antibodies and T lymphocytes attack itself. And that can be different for each individual. Different organ systems can be involved, and almost every part of the body can be affected. So every patient usually has very debilitating fatigue, joint pains, muscle aches, and beyond that it could be kidneys, heart, brain, lungs, skin involvement. It's really different for each individual. Support for patients living with lupus is so important, especially from organizations. Education, providing information, and really living with lupus on a day-to-day basis can be really challenging.